to the President's Podcast with the Black Nurses Association of Greater St. Louis. You are listening live to the President, Dr. Leonora Muhammad.
And my name is Quita Stephens. I am the co-host.
Yes, thank you. And immediate past president of the Black Nurses Association. So welcome to our show today. We have a good one, you guys. On our last episode, we called it Nurses Legacy, and we heard from our student member, Miss Maria Roop, and she talked a little bit about nursing through the eyes of a student. But today, we are going to talk to the pioneers of nursing in the St. Louis area. We are super excited to have the Homer G Phillips Nursing Alumni Association. We have the current president, Miss Yvonne Jones. You want to say hello?
Hi.
Miss Yvonne, yes. And we have our first vice president, Miss Johnnie Farrell.
Hello, everybody.
Nice to have you. And our immediate past president and outreach coordinator, Miss Jobyna Foster.
Good evening, everybody, and thank you for this opportunity.
Yes, we are super excited. We have met and we have worked alongside these ladies in the Homer G Phillips Alumni Association back when we had a conference here for the MBNA conference in 2018. We welcomed the ladies from the Alumni Association to our conference, and we honored them like crazy. We dressed in all whites, just like they did when they were working in the nursing. So we were super excited. Everyone loved it. I'm going to have to put some pictures on this podcast so that you can see what we had going on in there. So we really enjoyed having them as part of our conference, and we definitely honored to speak with these ladies today. So we're going to start out with you, Miss Jobyna. Can you tell us a little bit about the history of the Homer G Phillips Nurses Association?
Yes, I'm delighted to talk about the School of Nursing that we attended. 3 years, 3 marvelous years, I should say. And we were organized, the first graduating class was in 1922. And at that time, we had 4 graduates to graduate from the Homer G. Phillips School of Nursing. The Alumni Association was formed at that time. And at each graduation period, the nurses become members of the Alumni Association. It was formed by our instructors. And since that time, I had the opportunity to meet one of the founding members of the organization. And later, as I went through my nursing service, she began to, I won't say harass me, but she would run me down. Jobyna, when are you gonna take over? When are you gonna take over? When are you gonna take over? Well, it was some time before I actually took over and became the president of the Alumni Association. My attendance there at Homer G. Phillips was in September of 1957 is when I graduated. I entered in 1954. And with 3 years of services there, rotating through all the specialties and getting the most excellent training that one could get, I graduated in September of 1957. Oh, it was a great honor for me to become the first nurse in my family. Wow. And I cherished that education because I got to meet so many nurses from all over the world. I tell you, many of the stories that they gave us at that time were astounding in that they had no place to go. And they thought and thought and thought, and then finally they heard about Homer G. Phillips School of Nursing in St. Louis, Missouri. And many of them arrived at our School of Nursing and Hospital from the South, from the West, from the North, from the East, and from all over the United States and outside of the United States. And to this day, we have graduated 1,037 graduate nurses from the Homer G. Phillips Nurses Hospital Association. And at this time, we had at least 2 living 99 approaching the Octarian era of nurses that we're in contact with. We just honored one, Dorothy Monroe, and yesterday I was in touch with one of the graduates, one of the students of one of the 99-year-olds who is approaching 100, who just turned 99 years old on the 27th of May.
Wow.
So we are grateful to still have our alumni members still with us, and that we can give a lot of credence because we're standing on their shoulders.
Absolutely.
And to talk to these young nurses and to tell them how far we have come, it's a great honor for them to even to listen and to have us around to tell them of our great adventure. My experience has been in pediatrics, and I chose pediatrics simply because I say, just like my cousin, Dr. Harvey, I don't do adults. Adults do not obey. And when you take care of the children, I don't care how sick they are, you can give them a dose of medicine, a dry diaper, something to eat, a bottle, and they are up and running again into everything.
Absolutely.
It was a great experience to be there on pediatrics at 5 South at Homer G Phillips Hospital, and to stay there after graduation and to work with many of the head nurses and assistant head nurses throughout the hospital until I became trained in the field of a head nurse.
Wow.
In pediatrics. And I was greatly honored, surprised at all of the things that go along with it. With that experience, I tell you, we learned so much in taking care of children, whether they're sick or whether they're well. Many of them just coming from their well child checkups, and also to get their immunizations. So it was a well-rounded experience in pediatrics. And not only that, I might say, to go through that hospital for the services of 3 years and to take care of patients, whether they were adults or children, was the most delightful and the most noble thing that we could do.
Mm-hmm.
I saw the public health nurses come to my mother's house and take care of my sisters. And I thought then, I am going to become a nurse.
Wow.
And I heard about the Homer G Phillips Hospital School of Nursing through one of my mother's friends. And I began to search it out. I didn't have a high school counselor or anyone to really give me the instructions and the directions in which to go, because we didn't have a lot of hospitals that had schools of nursing. So we had to be very careful about our choices and who we took in. We just didn't take in everybody. You had to be top in your class, the upper third of your class, high school. And then once we got in, they had interviews for us that were so thorough in terms of how well-rounded you were, how cultivated you were, not only being educated, but just to see overall what kind of person we would be to take care of sick patients, as well as some well patients. I love the experience. I love the experience of meeting all the nurses from around the world, which at this time I can go in just about any state and call a Homer G Phillips nurse and say, let's have lunch.
Wow.
Right.
It's a thrill. It's a thrill, I'm gonna tell you. Even now, when we are out into the city, in the community, and we run into our patients, and they'll say, oh yeah, I remember you. You are from Homer G Phillips. Yes. I was born at Homer G Phillips. They're so excited. My aunt was there at Homer G Phillips Hospital.
Right.
Well, that is so encouraging to us, makes us stick out our chest a little further.
Absolutely.
And to know that we are known in the community as one of the best schools of nursing in the nation, along with our hospital, where we got our training. 3 years of training, with the best instructors, doctors from all over the world, whom we helped to train, because many of them didn't know English. They didn't know their way around the city of St. Louis. They didn't know our campus, and our campus was near and in a community that you could go from elementary school all the way through college, because Poro College was there. That was cosmetology and beauty. And then the high school of Sumner was there, which they're trying to close now.
Right.
And that alumni association is fighting to keep that school open. So we do think it's going to be a arts community art school or something of that nature, but it will stay open. And then there was the grade school. The elementary school was there, and there were students who were deaf, and the deaf learn in the school right there on that campus. And from there, they could go to Sumner High School or another specialized school if they required additional care and services.
Wow.
So the experience was great. We came from a school that not only had the School of Nursing, but we had 4 other schools. The medical school of medicine for the interns and also the externs, which we helped to train. And then there was a School of Radiology for those who wanted to be X-ray technicians. The School of Medical Records. You wanted to be a medical records librarian. You could go there with Mrs. Sherrod, and she would teach you how to be the medical librarian. And then last but not least, we had a great laboratory that from many, many experiences, and also speaking to the great Dr. Blosh, who trained us, who often came to our classes and gave lectures about the various bacteria and viruses that are in the world and with which Homer G Phillips was associated. We learned quite a bit about our laboratory there at Homer G Phillips from Dr. Blosh and his staff. The X-ray department, where we learned about all the various kinds of X-rays being taken, and we were one of the first to get one of the greatest scan machines here in St. Louis, long before Barnes or Jewish Hospital. And Dr. Allen, William Allen there, helped to develop that X-ray department whereby it was #1 in the nation. In fact, Homer G Phillips was #1 for training the interns and externs coming in from the area. Also from Fisk University, Howard University. All of the schools of medicine from those universities were coming to Homer G Phillips for their residency and internships and externships. It takes Dr. Page, who will be featured in our book when it comes out. He's also featured in our video, The Color of Medicine, that talks about how they came to St. Louis and the train stopped and they heard about Homer Phillips and they were on their way to Kansas City to get a job. And they heard about Homer G Phillips and they all landed here and took their internship there at Homer G Phillips. So we have some great stories to tell.
Oh my goodness, you probably can go on and on about this long-lasting history. And it really seemed like it was really more than just a nursing. It was a community, it was a family. And people were coming from all over to be a part of that legacy. So Ms. Yvonne, tell us how you came to Homer G Phillips and started your nursing career.
Well, Dr. Muhammad, while Jobyna was talking, I was thinking maybe Johnnie could tell you about all the services at Homer G Phillips Hospital, because we had everything going on over there. So could Johnnie do that? Tell us.
Yeah, absolutely.
All the,
Ms. Jobyna talked about everything that was going on from the different areas, the X-ray, radiology, medical records. Yeah, so
well, because we had 5 floors. So Johnnie could tell us all the services that we had.
Wow. Okay.
Johnnie.
Okay, well, I wasn't expecting this, but it's okay. My heart was the emergency room. I was the emergency room nurse and supervisor. Then we had adult medicine and adult male and female medicine, 2 separate floors. They were not integrated floors. Same with adult surgery. The only integrated floor we had was 5 North, which was ENT, eye, and orthopedics. But there had been 2 wards, females on one side, males on the other side, and GU for, well, no, it wasn't, because OB was 4 South, and urology was 2 South. Pediatrics, Jobyna and Yvonne's area, was 5 South. All of the specialty services were in the middle of the building. Radiology, 5th floor, labor and delivery, 4th floor, operating room, 3rd floor, and lab, physical therapy was on the 2nd floor. 1st floor was all administration. And then the emergency room, which took up the whole ground floor. We also had a psychiatric ward at one time. We had a NICU, a pediatric intensive care unit on 4 South. Then we had a prison ward at one time.
What?
Yeah. Prisoners. We'll bring them in. And I'm thinking we had EKG department, and we had a respiratory therapy department. And toward the end of Homer Phillips, the hospital inpatient, we had Dr. Shelton, who started our dialysis unit. So toward the end of it, the hospital existence, we opened a dialysis unit on 1 North.
Yes, and this is unheard of. That complex is huge. You know, my mother, you know, right now they have turned it into senior living apartments. And actually my mother was a resident there for a couple of years. And just being in that facility and looking at the walls and just imagining what you ladies were doing when you were, you know, providing care for the patients in a community where, you know, we didn't have all the services that other hospitals had. So that was just amazing. And just walking through that just makes me so proud. And I see like little pictures of history on the wall. And I just think about all the patients that you guys cared for when you were walking through. And it's amazing that you still know the names of the floors and what department was in what area. That is amazing to me.
I knew Johnny would remember.
It is very amazing. So ladies, what I want to ask next is we talked about the services that you all offered, you know, historically. But now, as we are nurses now, we know that there's a lot of need in the community and a lot of things that we have to continue to do as nurses in the community. So tell us a little bit about the services and the events that the association does now for the community.
Well, with Ms. Jobyna Foster being the outreach coordinator for our nursing group, we have 4 nurses that help with the immunizations. Jobyna also, we gave lunch for the nurses at the Homer G Phillips Clinic when they first started giving out these immunizations. We also do scholarships. So far, we've done over 20 scholarships for those who are interested in nursing that are actually going into the nursing program. What else do we usually hear from?
It's a renewable scholarship. If that student gets a scholarship, it's renewable.
Right.
That's good to know.
Yeah.
Then I wanted to mention the fact that we have volunteered with American Heart Association.
Yeah.
Also the American Red Cross.
Right.
We have 2 of our nurses to train for the disaster services. Also sickle cell. We have one of our nurses, the nurse practitioner, who excelled in sickle cell therapy, education to parents. And as we are being approached, and perhaps because our video is out there on YouTube, more and more we are getting requests to serve the community. And with us being connected to the Black Nurses Association and their wonderful president, past president, Ms. Stephens, we are working in conjunction with many of the programs that they are involved, and where we can lend a hand financially as well as with our own services bodily.
Right.
Yes. Absolutely amazing. And we continue
Right.
to work in the community doing some of those same things, working to, give out the COVID vaccine. And some of the local churches, a lot of organizations reach out to us to say, hey, can you guys come down and help us with the vaccination clinics? Of course, we do our typical blood pressure screenings and education for the community because we know that's always going to be a need. So we are happy to always partner with you guys. So if it's something that you need us to jump in and get a group of nurses to come out, we absolutely would love to do that. And we absolutely love watching The Color of Medicine and seeing you guys starring in it. That was just such an amazing thing. A couple of members of the Black Nurses Association was able to go to the viewing and see that. And again, I don't think a lot of us knew the entire, Quita said she's seen it twice.
Yeah.
We didn't know that history. So it was amazing to see that on the screen and for people to be able to find out exactly what you guys were doing and how did it get started and what was the history of the hospital and how we know nurses train the docs and help train those doctors. We know that and we say that now because they need us and we need them. So it was amazing for you guys to be a part of that history and that story. And that came out, about 2018, I believe. I think so.
Yeah.
Yes, it has been 3 years now.
Yes. And so you touched a little bit about a book, Ms. Jobyna. I heard you saying something about a book. Tell me a little bit about this book that's coming out.
Yes, we do have a book that is almost being published for sale. In the meantime, one of our nurses was in contact with one of the instructors over at Washington University. And not only the instructor, but one of the writers. So they became friends, and she found out about our Homer G Phillips Nurses Alumni Incorporated. She wanted to write and I wanted to know more about us, so she began to ask questions. And then it went from there to individual interviews. Once Dr. Tillman let her know who to contact and how strong our association is, then she began to speak to us individually, and that's how we became, well, I'll say stars of that video.
Right. Yes, absolutely,
and
stars.
Now we're in the book because she has begun to write about each individual as she has interviewed us. She just came to our meeting of April. No, when did we have it?
No, May. It was May.
Our last meeting, May, and gave us an update on how close she is to finishing it. Asking for a couple of pictures of some of our star instructors, and just putting some final wording to it. In touch with the publisher, giving us final sales talk, which we have been asking for, how much is going to be $40. And of course, the alumni getting some of the monies for our scholarship program. And so we're just waiting, sitting back waiting.
Yeah.
And hopefully by the end of this year or first of next year, she'll be finished with it and it'll be out for sale.
Great. Do we have a title for the book yet?
No,
she didn't give us.
Oh, okay.
No, she didn't give us
suggestions. Yeah, she's taking suggestions.
Oh, okay. Well, we will definitely be waiting to read that book.
Yes.
Dr. Muhammad, I forgot to mention that we also, Goforth School of Nursing has a scholarship in the name of Homer G Phillips Nurses, and they just gave out a scholarship to a young lady from Ghana.
Oh,
the
wow.
amount of
Okay.
$15,000. So,
Woo! $15,000.
so go for our School of Nursing. They're going to put out a pamphlet with our picture from the 2018 convention, trying to get monies for the scholarship, but they did start a scholarship in the name of Homer G Phillips Nurses.
Okay, that is wonderful.
Yeah.
And congratulations on that, because those scholarships really help the students. They need it so greatly. And everywhere we go, we talk about, the challenges that students have now and, trying to avoid getting student loans and getting into debt, because we know that happens in our community. So as much as we can help them and to provide scholarship for them, we absolutely love to do that. So any of the listeners out there today that want to donate to these scholarships, you can also get in touch with us at the BNA of Greater St. Louis, and also reach out to the Homer G Phillips and go for School of Nursing to donate if you see fit. So our students, like I said, I called this episode The Nurse's Legacy, and with students, they are starting their own legacy in nursing. So, and I know you have been nursing since the 50s, like Ms. Jobyna said. So you've seen changes in nursing from the 50s all the way up to now 2021. So what changes have you seen? What do you think about the state of nursing today? How different is it from when you ladies started? I know from some of the ladies that I've worked with that became nurses in the 70s or 80s, when I was born in 81, say it's so much of a difference. So I can only imagine what your eyes have seen. So I'll throw this out to any of you ladies. Tell me what you think about the state of nursing today.
First of all, I need to go all the way back to the student nurse uniform, all the way up to the graduate nurse uniform, all the way up to now, what we're wearing and what we're seeing as not really being nurses. They're being all nurses. They got rid of the cap. We had 6 whole months of preclinical training that if you did not pass, you did not get a cap. That cap meant so very much to us, in that we worked so hard to earn it. It was a great ceremony. Our parents came, our friends, the entire community was there to celebrate our capping ceremony. It was most important in that after we got the cap, we were taught where to wear the cap, how to wear the cap, how to take care of it. And when I think about that and getting rid of it and all the things that we had done to get that cap, it just breaks my heart. It even breaks my heart to see us in navy blue, black, a mixture of black and blue. Shades of powder blue.
Pink. We got all kind of colors now.
Rid of the entire beautiful white uniform. Which I'm gonna tell you, people used to ask us, how is it you keep it so white? How do you keep it so clean? And you're dealing with blood every day and all kind of body fluids. We knew exactly how to wear that uniform. We wore it with pride, just like we did the cap. Our shoes. Today, the shoes are tennis. And I'm hoping everybody's seeing a podiatrist. And I'm also hoping that everybody's wearing some sub-holes. Because at this point in my life, and many of my nurses are at the same age that we are in our 70s and 80s. And we look at our legs. You see any varicose veins? You hear any complaints about their feet? No, we had the best of shoes. Taken every class was taken every year on a chartered bus to Famous Bar, and Famous Bar had a special room called, it'll come to you. But anyway, that room had all these beautiful cushions, and we sat there with our director of nurses. And each one of us were measured specifically for these high heel shoes. which we walked every floor in that building in those high heel shoes. No wedges, no clogs, and no tennis shoes, definitely.
Yeah.
So a lot has changed. I have seen much in terms of just going all the way back to where we had the stripes and the apron and the cap, the beautiful long sleeve white uniform, to what we're in now. Breaks my heart.
That's definitely a noticeable change. And I'm mad because I wanted to wear the hat. You see my hat in the background here. I'm mad because I want to wear it every single day.
Right.
Yes.
And you know, patients really respected that because they used to say they could tell who was the nurse. Well, now you don't know who in Jesus' name is the nurse. You can only hope that's who you're talking to now. And Miss Wanda Trotter, who couldn't be on tonight because she has illness in the family, she worked for one of the home health agencies at this late day, and she said that there is a problem recruiting and retaining nurses, that they would show up for the interviews, but then when they got hired, they didn't come to work. And to me, things have really changed. When we were nurses, we really didn't go by the salaries. It's just that we wanted to help people. Right. And now it seems to be a big difference that is based upon the salaries. When I was in the hospital, well, at one of the hospitals, I was kind of upset because the nurses basically were sitting at the front with the computers, and that's how they watched you, while I guess the nurse assistants, you know, gave you the help that they needed. I just wonder if we need to have a class on compassion and kind of remember what we're there for. It's not about the money, I tell you, because if it had been about the money, I wouldn't have been a pediatrics. I did it because I loved it. And I'm hoping that we'll get nurses that really just love to do the job. And because that has really changed, really has.
True.
Johnny got a picture while they were talking.
Okay.
This is a group of 60 newly capped freshman nurses at the Homer Phillips. This is our class of 1968.
Oh yeah, we're gonna have to get a picture of that, Miss Johnny. I'm coming.
Yeah, with all our caps on. Yeah.
Yes, we need that. We definitely.
And would you believe that if I'm not mistaken, Johnny, the tuition at that time was $385.
Oh my goodness.
It was very low.
For nurses. And my mom, bless her heart, had a problem even paying for that because she did housekeeping at the Paul Brown building downtown. So compared to the tuitions back then and tuitions now, oh my God.
And that's what we're seeing. Yeah, those you know, that, and that's why we try to have those scholarships, because the cost is it's ridiculous now. And I really understand what you're talking about as far as what has changed from then to now, because the passion, I think that is the biggest thing right now. Quita always talks about passion. From the first meeting that I came to with the Black Nurses Association, Quita was speaking, and she was talking about the passion and what is your passion in nursing and why do you do what you do, and you know, being able to, she talked about, and this was one reason why I continued on with the Black Nurses Association, came back to the next meeting, because Quita was talking about going to the conference and being able to see all of those Black and brown faces in the room, and seeing that these people were doing magnificent things, have become doctors, nurse practitioners, have been doing all of these things, working at these prestigious hospitals and organizations. And she didn't let up on that passion. And that's one thing that we always still in our generation is trying to instill in these younger nurses and these students coming up. It's like you should want to be in it because it's what you want to do as far as helping the patient, and not for the salary and the money. You should want to be here because you want to improve the care of the patient. So that is something that we try to instill in our younger nurses that's coming up. Quita, you want to talk a little bit about that?
Yes. And that is very, very important and something that we lack. So being repetitive in communicating that you will be called out if you are not displaying the compassion, because that's where nursing started. And you ladies blazed the trail for us. So listening to you all talk about the history of the uniform and how you wore it, those things need to be continually told, even to the ladies that are coming up or men that are coming up to being nurses now, because they don't know about that happened back then. They need to know that when they see a white hat, that is supposed to be something that's cherished, not just thrown to the side. So hearing it from you all is very important. And so with our first segment, we did an interview of one of our nursing students, and she's starting her nursing journey. And she spoke about the challenges that she received or dealt with in the pandemic during last year. What has your organization experienced as far as any challenges or struggles when it came to the pandemic?
Well, one thing I know is that we're not able to get together to have our meetings. We usually have a meeting every other month with the summer off at Homer Phillips. And then with the pandemic, we were unable to get into the building anymore. And then, of course, we were supposed to have had a reunion, 2 years ago?
No, it would have been this past year.
Yeah, and we had to cancel that. So we wasn't able to do that. So that has been a strain, because most of the time when we have our reunions, it's the nurses from out of town that come.
Yes.
And it's just amazing to see them coming to the reunion. So we haven't been able to have that for a while.
Okay.
Yeah.
I might add to that, since I am outreach coordinator, I have begun to go through our directory to reach out to our nurses that are in California, Chicago, Michigan, to try to keep in touch. And now that we have teleconference, I have been able to have at least 2 of our nurses have chimed in. One of them is working on our board. So they will call in and be in our meetings, and we're happy about that. Real happy.
Yeah, we've had that same challenge too as well. We live in Zoom now, so we've been doing our Zoom meetings and trying to connect, but I will say it is a plus to that, because we're able to reach a lot more people that may not be able to come out to the meetings, but being able to just chime in, and people that's working, we've had people call in, on their little 15-minute break to see what we're talking about and what we're doing in the community. So it's got its little pluses, but we absolutely have been challenged. And we talked a little bit to Maria, our student, last episode about that, and how the change in curriculum had to happen, as far as the students going into the hospitals, couldn't go into the hospitals because of COVID. So we had to change up how we were instructing the students and do more simulations with the mannequin versus being able to go into the hospital, which was a bummer for the students, because they want to touch and it really made me happy, because I was like, oh, the students, they were kind of upset they don't touch a real patient. They said, we want to touch real patients. And I seen a little bit of that passion that you guys are talking about in those students, which made me happy that they were kind of upset that they wouldn't be touching real patients. So but I told them they're going to be very good at putting on gowns and gloves and masks, because they had to do that from day one and get that right, dealing with those patients. So what kind of advice would you give the student nurses that are in school right now? What kind of advice would you tell them to help them in their nursing careers moving forward?
Well, I'm thinking about the in-services and the educational opportunities that were offered us as student nurses. I remember getting a chance to go to Great Lakes, Michigan. The recruiter came down to Homer G Phillips School and gave us a very good program with regards to being a nurse and serving in the military world.
Okay.
Well, I almost made it there, but knowing some of what I've heard in the community, I changed my mind about nurses going into a predominantly male area. Females going there and becoming nurses. So now I'm seeing some of the reasons why. Even now, it's been in my mind, should I have gone that way or not? If you have to fight off some of what they're fighting off now from the fellows. But in addition to that opportunity from the military, we were often exposed to the in-services at the universities. And you could get your CEUs, remember the CEUs we would get called continued education units? And you got so many, and then it became a whole credit. And then when you went into the university to work toward your master's or your BS degree, those units were utilized, and it helped you. It not only helped you in that sense, of course, it gave you the updates of what was going on in the world, in the community of health. Another opportunity I thought about was when we had the medical library, the American Medical Library where we could go down and look at the journals. The American Journal of Medicine and the American Journal of Pediatrics were very key to me. And I read those journals from front to back. The other opportunities I thought about was when the interns and the externs would have their morning rounds. And one of us would be chosen to make the rounds with the doctor. And of course, you would be out there with the head resident of pediatrics. And if you had any confidence at all in your head resident, and those surgeons came over, you would show them exactly what to do in your own area. Don't forget the side rail when you examine the baby. Don't forget to put the pen over towards this side so that the baby, those kinds of opportunities that we took advantage of and taught them about pediatrics. And then we learned from them. They would show us how to take care of a burn patient in a sense of what to do with the solution of silver nitrate. You all heard of silver nitrate?
We have.
We have. Yes, ma'am.
But learning from those doctors on how to use it and use it in wound care, so I totally agree with that. We need to soak it up.
Yes, we had to reroute with some of them. The others, we did learn about surgical dressing, how to, carefully remove the dressing, how to handle and use your sterilization techniques that you had learned in the operating room. Each one of our divisions had a little small examination room. And in that examination room, many times we would take, and me being on pediatrics, we would take the baby there and be right at the bedside, at the table side with the doctors when all these procedures were being formed. Gastric lavage, they would show us how to insert the tube. We learned how to suction. We learned how to put the patients in traction. 5 North was the orthopedic division. And at one time, I had the opportunity when we had to go to City Hospital #1 on rotation. And then when we had to really move down there, I became the supervisor of orthopedics. So I already knew how to apply traction.
Right.
To put a cast on, because we had the most excellent technician who was not a nurse, but an LPN, who was highly skilled in putting patients in traction, motorcycle accidents, car accidents, you name it. And not only that, the doctors they relied on him to do it. They leave him, and he would properly put the cast on, put them in traction, remove the cast. He knew how to do that. He knew how to take down the traction and the patient. Just excellent, Mr. Frazier. Those opportunities being at the bedside with the patient, with the doctors, and with our head nurse, Dr. Helen Nash, our head resident, Dr. Helen Nash and her staff, her brother, and now her daughter, her nephew, and her niece. And then those residents that had come from the Philippines, Jamaica, Haiti, Germany. We even had Dr. Pistachios was from Mexico, I believe.
No, he was Filipino.
Filipino. We had someone from all of these various outlining areas of the world to come and train at that hospital. Wow. And we became a part of their training.
Absolutely. That is so much great advice to get the students. They need to, and nurses, just period, you know, try to soak in as much as you can from the doctors. And, you know, I tell nurses that all the time. It's like, if you see somebody doing incision or, you know, doing some type of drainage, or, you know, come in there, see, talk, sit down, watch, you know, learn. You can learn so much from the providers. So I absolutely think that is excellent advice. And just to be clear, at the Homer G Phillips, it was all type of patients, right? Black, other races patients. You guys took care of everyone, right? It wasn't just African-American patients, right?
Right.
Okay.
But
you know, Homer G Phillips was noted for gunshot wounds and stab wounds. If you had any kind of injuries, go to Homer G Phillips. That's what they were basically noted for, was trauma.
Right, trauma. Okay.
Trauma. I guess I would like to tell the future nurses to follow your dreams and your compassion. There's so many areas of nursing that you could get into, but you will know the right one when you graduate, what you feel more comfortable in. We did everything. We did psych, we did medical surgery, we did OBGYN, we did delivery. And I found for myself, pediatrics was what I loved. And I did that from 1968 to 2013, I think.
Wow.
And I guess it's because, and I never had any kids. So I considered them as my children. Right. And I really enjoyed doing that. And it wasn't about the salary. It was just about taking care of other people's children.
Right. So find your passion and
find your passion.
Yeah. And you don't have to go into one area. Try it out. See what you like.
Right.
And then you'll know when you get there. You'll know. What about you, Ms. Johnnie? What do you want to tell these youngins?
To expand, find your passion, but expand your horizons. Don't just fixate on what's going on in your community, what's going on in our world as African Americans, but expand and understand other cultures, because you're going to be exposed to that. I'm currently a school nurse, and we have English language learners. That's what they call the students from ours. And you learn a lot about their culture. And as a Homer G Phillips nurse, we actually taught a lot about the culture of our communities to those doctors who were coming from other countries. And by me being an emergency room nurse, I was always called kind of volatile, because if they said something I thought was disrespectful, I would check them. And I would still do it today. I have no problems with it. I'm just that type of person. What Jobyna had said earlier about coming from everywhere, I'm the nurse from the South. So I grew up in segregation, in the segregated South, and during the civil rights era and all of that. So I confront anybody anytime, and I'm ready for the fight.
Absolutely. And you know, the term that we say is having cultural competencies. You know, we have to know about other cultures and know how to deal with patients from all over. Like you say, we're going to see all type of patients, not just African American patients in our community, but we work in everywhere, you know, with all different people. So I think that is absolutely excellent. I actually had the opportunity in my BSN program to go as well, they had a nursing study abroad, you know, so we went over for like 2 weeks, well, like 13 days, and to Europe. and seeing like nursing in other places and how they did it. It was a stark difference from America, how they treated patients. Some pluses, you know, some minuses, you know, but definitely learning about those other cultures made you appreciate, you know, and then come back and want to do so much more for our own community. So I absolutely think that's great advice. So, well, it has been a joy. Quita, were you gonna say something?
I was just gonna piggyback on that, because when I was a new nurse and a baby nurse at St. Louis University Hospital, had no idea what I was doing, but a nurse from the Philippines was one of the ones that was the best nurse on the 5th floor. I worked on 5 North. And she took me under her wing alongside a LPN. And she told me how to be a nurse on that floor. I could always go to them. So having respect for them, and anybody that shows you passion, you have to get up under that wing and fly and learn how to fly. Absolutely. And that's a very good thing to give to our nursing students, for sure.
Absolutely. Well, it has absolutely been a joy talking to, I call y'all pioneers, and I'm going to keep saying that because, again, like you said, we stand on your shoulders, you know, of what you laid out and put in place. And we just hope that we make you proud with, you know, our generation of nurses and, you know, instilling those stories. So I'm glad you shared your stories with us, because we're going to continue telling those stories. And that's the legacy of nursing. And we're going to continue our parts to do the same thing. So tell our listeners, where can they reach you? I know Ms. Jobyna is the coordinator for your Alumni Association. So tell folks how to reach you and get in contact with you if they need you to come out in the community and help.
For any additional information, you may contact me, Jobyna Foster, Jobyna Foster, Foster, AT&T.net. That is my email address. My telephone number, area code 314-954-5456. That is my cell phone number. And my home phone number is area code 314-261-2800. Any information that you need with regards to the upcoming book, how to get a video, how to get us to collaborate with any community services, just contact me and I'll certainly pass it on to our president and our group members.
All right, thank you. And we are waiting for that book to come out.
Right, and we appreciate you inviting us in on this podcast. We really thank you.
Oh, yes, we owe it all to you. So, Miss Quita, tell us where they can reach the BNA of Greater St. Louis.
You can reach the BNA of St. Louis in multiple places. You can contact us via email, bnagreaterstlouis@gmail.com. You can reach us on our website, www.bna-stlouis.org. Or on our social media outlets. We have a Facebook page, we have an Instagram page, just put in BNA Greater St. Louis, we should pop up, and also on LinkedIn. You can contact us at any time, send us a DM or an email, and we'll be glad to reach back out to you.
Okay.
Yes, and you want to support and donate money to us, we will take it so we can help in the community and help provide scholarships for our students, whether it's through the Homer G Phillips Nurses Alumni Association or the BNA of Greater St. Louis. We need your help, so please support us. And we also have a donate on our website too as well, if you want to just go there and donate to the cause. So, well, thank you guys for tuning in to the President's Podcast with the BNA of Greater St. Louis. Be sure to check out our podcast on YouTube and our social media pages. It's typically on every Wednesday of the month at 7 p.m. But we're doing a special one today, but we're going to put that out later this week. So make sure you like and subscribe to our YouTube channels and our social media pages. So tune in next time, because we are the pulse to all things nursing in the loop because of Homer G Phillips Nurses Alumni. So thank you for joining in. So see you later.
Thank you.
Thank you for inviting us. Enjoy.
Bye.
Yes.
Bye.